Hi everyone, in today's video I'm going to be taking you through a study that was just published last year, and the study actually examines the safety and usefulness of a psilocybin-assisted therapy that was implemented for war veterans who suffer from post-traumatic stress disorder and who have been resistant to the normal therapy treatment for post-traumatic stress disorder. So we already have growing research indicating the benefits of using psilocybin in treatments for OCD, anxiety, depression, addictions, in conjunction with psychotherapy. This research actually demonstrates many benefits of using psilocybin in conjunction with psychotherapy. And also, what is really important, what this research indicates, that there are very minimal side effects of using psilocybin in those treatments. Military veterans is the population that substantially suffers from mental health problems comparing with general population. And some of the reasons for that, it might be that they're exposed to several military deployments and intense combat incidents. Additionally, there are reports indicating that the suicide rates amongst military veterans are actually much higher than in general population. And again, there could be many different factors that might be contributing to that. So when they suffer, for example, from post-traumatic stress disorder, that very often is comorbid with depression, anxiety. We could have the social culture aspects, the fact that the treatments that we offer for post-traumatic stress disorder, they are not as effective for military veterans as maybe they are for general population. So definitely there's a lot of limitations in the psychological and also the pharmacological treatments that we offer to military veterans. In the study that we're going to be talking today about, the researchers, they recruited 15 USA war veterans. They were male and female. Participants, they received 2 doses of psilocybin. So the first one, the low one, was 15 milligrams, and the second one, high moderate, that was 25 milligrams. And that was in conjunction with the psychotherapy. Before participants they could receive the first dose of psilocybin, they needed to meet their 2 therapists for 8 hours, and this 8 hours was divided into 4 sessions. And in those sessions, they work on developing a trusting relationship in order to avoid participants developing any fears and anxieties while they're going to be taking the medication. And also they talk about the history of the person, they talk about the current issues, what they're struggling with in their current life. They talk about their expectations, their intentions, and their goals for the treatment. They also explore the trauma, the history of the trauma, the symptoms of the post-traumatic stress disorder. They talk about their perceptions of their strengths and their weaknesses. And there was also a time spent on the psychoeducation about this treatment. So if we really think about it, this is exactly what we do in a psychotherapy, where maybe we're planning to do relieving or imagery rescripting with our patients. During the first psilocybin session, there's going to be at least 1 trained therapist to assist them if needed. Then they're going to be asked to lie down on the sofa, cover their eyes, and they're going to be listening to music. And this music is normally prepared beforehand by the research group. And this is all done to help the person to focus on their inward reflections. Throughout the day, after the first session, after the person ingests the psilocybin capsule, every 30 minutes, any symptoms, they're going to be reported. Participants, they're going to be also asked to complete a questionnaire, and also they're going to be asked to write a narrative about their subjective experience of using this medication. The second session, when participants, they consume the psilocybin, is at least 2 weeks apart. And then there's also a follow-up period that is about 6 months. In those follow-up sessions, they talk about the narrative that they wrote about the subjective experience after consuming the psilocybin. They talk about the post-traumatic stress disorder symptoms, and they also talk about integration of therapy into day-to-day life. The follow-up sessions are needed to help the person to make sense of their reflections and also of their narrative. So for instance, we could have someone who in their first psychedelic session might have an image of the parent suffocating them with a pillow. And they could actually conclude from that this is a suppressed memory. But with the help of the therapist, they can actually gain the understanding that it wasn't actually anyone physically suffocating them, but it was more to do with the environment where they grew up. So they actually had the sense of suffocating. The results of this research indicate that there were a significant decrease in the post-traumatic stress disorder symptoms even 1 month after the final dose of psilocybin. And if you would like to find out more about the specific maybe questionnaires that they use, the statistical measures they've used, you can follow the link that is down in a description box, and that will take you straight to this research protocol. So that will be it for today, and if you enjoyed this video, then please like it, subscribe, and make sure you're gonna hit that notification bell, so every time when I upload a new video, you're gonna be notified, so you're not gonna miss out any of this really interesting content. And I'm gonna see you in the next one then. Thank you. Bye bye.